And this center is actually quite timely in that with the advent of biological therapies and immunotherapy and minimally invasive surgery, we've made some inroads, and the aim would be to try and disseminate these advances across different centers. So there have been a few randomized controlled trials which have shown very clearly that in patients with distant metastatic disease, you can offer them biological therapies, immunotherapy, and extend their survival. It doesn't happen in all patients, sadly, but in a good proportion of patients, we're seeing much better outcomes than we did even 5 years ago. So that's changed dramatically. So it means that even a step improvement, if we work on it even further, could potentially lead to better improvement in time. From a surgical perspective, we've learned the disease. We understand the disease better, but we need to understand even more about this particular disease. And with robotic surgery, for instance, which is my specialty, we managed to perform a piece of work which included the expertise of 16 global centers who do high volume robotic surgery. And our recent work has shown very clearly that transoral robotic surgery, which is minimally invasive surgery, is quite an effective modality in treating select patients with recurrent oropharyngeal cancer. And this is a surgical procedure which would take 2-3 hours to the most. In the past, for these very patients who had recurrent oropharyngeal cancer, the conventional management and the standard of care was to open the neck up, split the jaw, go into the throat, take the tumor out, and reconstruct using a free flap. We've done away with a lot of these steps. There's no more jaw split required. The whole thing is done from inside the mouth. And we have shown that across a cohort of over 280 patients, you can achieve repeatable, good outcomes with minimally invasive surgery in this setting. So the field is ripe for research, and we can do many more to help these patients. So I think the IReC has been set up at the right time, which hopefully will try and leverage the expertise invested across multiple centers to create a network and therefore to help patients.